Okay, so the day after or maybe the weekend after I was down at Cheese and Crackers, I knew that I needed some money, and so I went down to Ghirardelli Square in San Francisco. I dragged my guitar down there, and I became a street musician. Now, there's a real problem with that, is that I'm just not very good, okay? But I don't think it made any difference because I sat there and I played the music that I liked and opened my guitar box, and I got donations. It was amazing. I got donations. And unfortunately, it wasn't always money donations. So like at the end of the day, I would have to sort through everything in my guitar box, and I'd throw out Ghirardelli M&Ms and throw out cigarettes. I don't smoke. I got a few marijuana joints, things that I didn't want to touch, and I felt like I needed tongs to get out of my guitar box and all that. But it usually worked out to about $5 an hour, which back then was enough for me to buy a few groceries, So if I did it for 3 hours, I'd make $15, go down and buy a few groceries. So it was kind of a good deal. One of the really neat things about this was that I got to meet some of the other street performers and all that. One time I played a song in exchange for one of the street poets reading a poem, things like that. And although I never met Robert Shields, who was the world-famous mime, who used to be down in Union Square in San Francisco at the same time, I did meet the human jukebox who was there. And for this guy, you could put a quarter in the slot, and he would open the flap and play a song on the trumpet for you. And he actually did pretty well. So here's my next hint for making it through these tough economic times. Okay? If you're running short on dollars, go down with your instrument and become a street musician. And you know what? You don't have to be any good. You can still make a few bucks just like I did. Want to help you out getting through these tough times. Okay. All right, state exchanges. This is a little bit easier stuff because this is just kind of informational stuff. State exchanges are to be operational by 2014. Purpose of the exchange is to provide online markets for individuals and small employers to buy health coverage. So think of that. Individuals can go to an exchange and buy coverage even if they don't have a job or they don't have employer-provided health coverage, or small employers are going to be able to go to the exchanges and actually buy group coverage for their employees. Now, Dina doesn't like me to talk about that, but we're going to talk about reasons why you might want to think about that twice before doing it. Okay. What the exchanges are going to do is they're going to have navigators who will help you through all the ins and outs of your choices, selections. They're also going to help individuals apply for cost and premium subsidies if they are low-income individuals. These are benefits that are provided under the Affordable Care Act. And in Oregon, we have led the way, one of the leading states in the country, to establishing our exchanges. And I think we're well on the way to doing it. We're going to talk about what the Oregon Exchange is in just a moment. We've had the Oregon Health Authority that's been in place since prior to the Affordable Care Act, because it's been a real movement in this state to develop exchanges and things like that. So we're well on the road to doing it. Terminology that you're going to have to become familiar with as you look at the exchanges are these. Essential health benefits, or EHPs. These are a set of benefits that a plan must provide to be a qualified health plan in an exchange. Okay? What we're talking about here is that every insurance company that wants to participate in the exchange by making coverage available through the exchange is going to have to cover essential health benefits in order to be a qualified health plan. A benchmark plan is a plan selected by the state of Oregon, that defines a standard set of benefits that may be sold in a state. And what the government and regulators in Oregon did was they went out and they took a look at many insurance policies that are out there in the marketplace, and they selected the one that most closely reflected what they felt should be covered by a plan in Oregon. That became the benchmark plan, which other insurance companies must pretty much copy, in order to have a plan covered through the Oregon Exchange. Qualified health plans are plans that, the health insurance plans that are approved to be sold in an exchange. So once an insurance company has developed these plans, they must submit it to the Oregon Exchange, and if the Oregon Exchange approves it to be sold through the exchange, it's going to be called a qualified health plan. Shop exchange, these are exchanges that small employers may use to provide health coverage options for employees. These are the actual arrangements for employers to go to, so that the employers may say, okay, we want to pick this coverage and this other coverage as options for our employees. The employees may then go and say which of those two options they want to purchase, and the way they're trying to make this work out is that the employer will only pay one single premium payment, even though one of the plans, for instance, may be a Regence plan and one of the plans may be a Providence plan. Okay? So they're trying to streamline this to make it easier for small employers to purchase coverage through an exchange. And once again, if you think back with those earlier slides I talked about, large employers, that is employers that have 101 or more employees at this time, will not be able to participate in these exchanges. The earliest that they may be able to do, depending upon what the government says, is 2017. So that might be something that some of you may have to look forward to in the future. Individuals wishing to purchase health insurance may go directly to an exchange or work through an agent. In other words, business as usual. Continue to work through Dina and her staff. Or you may go directly to the exchange if that's the way you want to do it. But there are things that I think you're going to want to consider before you do that we're going to be talking about in just a moment. Eligibility determinations will be based upon a single application and a simple year-to-year redetermination process. That's what they're telling us. It's interesting because we're reading right now that the forms that have been issued tentatively for some of the federal exchanges are like unbelievably cumbersome. One I read was 17 pages long. So, and that's for the individual to complete in order to get coverage through an exchange. So you can imagine some of the issues that are going to be there. The plans are intended to coordinate with Medicaid, CHIP, that's the Children's Health Insurance Program, and basic health programs to determine eligibility regardless of where the application is submitted. What that says is this: if you have employees who are receiving subsidized health coverage for maybe their children or whatever, this coverage that they're going to be getting through the exchange is going to be coordinated with that coverage so that it gives them the best coverage at the best rate, and they're going to give them assistance on making sure they make the right coverage decisions. So as of February 17th, and that's the most recent data I've seen, 17 states plus Washington, D.C. will run their own exchanges, Oregon being one of those states, and Washington being another one of those states. The federal government will run 26 state exchanges. 7 states will partner with the federal government to run their exchanges. In other words, what is this saying? The majority of the states are not running their own exchanges like Oregon is. Okay, we're getting a subsidy from the federal government to establish our exchange. That's going to last a couple years, and then it's going to go away. Essential health benefits. Remember I talked about the benchmark plan must have essential health benefits. These are the list of benefits that are right in the Affordable Care Act for essential health benefits. And to have any plan in an exchange, it must cover these essential health benefits. But the thing I want you to notice about this list is this, and I'm not going to go through this in detail. There are services that you commonly think of as being provided by a medical plan that are simply not listed here, like transplants. You see transplants anywhere on this list. Does it seem to fall anywhere within any of these? Well, hospitalization, yes, for transplants, maybe emergency service, I don't know. Prescription drugs, definitely. Rehabilitative and habilitative services and devices, maybe. The insurance companies have had to make some real decisions on a lot of things because these are the categories of benefits that must be included in a qualified health plan. There are benefits here that you have not traditionally seen in most group health coverages. For instance, pediatric services including oral and vision care. What this is children's dental and vision. You have not typically seen children's dental and vision covered under the group medical plan. They have been covered under vision plans and under dental plans, but not under the group medical plan. That's now a requirement under this law. Other requirements such as habilitative services. I understand that these are services that are to help individuals get back to their normal way of life, not just rehabilitation, not just regaining function, but getting back to the normal way of life. So there are benefits here that we haven't typically seen in the past that are going to have to be covered by the benchmark plans, the qualified health plans through an exchange. Yes? Mm-hmm.
That's the self-funded plans and large group employer plans don't have to cover those things. So if a small group buys their insurance, gets their insurance not on the exchange, then do they have to have those things?
Yes, the good question. How about small employers? They don't buy coverage through an exchange. because you don't have to buy coverage through an exchange. The law says that the insurance companies must offer the same coverage both inside and outside of the exchange. Meaning that yes, it's going to include the essential health benefits, and there's no way to escape that. Now, what's the other cost thing that we've been talking about here? Adding these little things like children's dental and vision that have never been in the plans before. It's adding a benefit that wasn't there before. It's going to increase the cost, increase the premiums. Okay? It's kind of been the common theme I've been talking about throughout here. Yeah, the question is that's a good question. What's it going to do to the costs under the dental and vision plan? It may reduce those benefits or those expenses, but keep in mind that a lot of employers didn't provide dental or vision. They maybe provided a little bit of vision sometimes as part of the medical plan, but if they didn't provide it before, it's definitely an additional cost. If they did provide it before, then yes, there may be a wash there, but I don't know for sure about that. These essential health benefits are going to include consumer protection standards. Discrimination is going to be prohibited. There's going to be special standards and options for non-typical individual and small group policies, such as the habilitative services I mentioned, prescription drug coverage standards, things like that. There's going to be a catastrophic plan permitted. I don't know if we're going to see any of those yet in the local exchanges. It's going to cover essential health benefits, but benefits paid only after satisfying a high deductible health plan. This would be for young people who are in good health and can't get coverage from somewhere else. There may be a low-cost, high deductible catastrophic plan available for those individuals. So you're going to have to jump through some hoops to be eligible for that type of coverage. Actuarial values. Here is a list of what they call the metal values of the plans. Now, all this says is this. A bronze plan is going to have a 60% actuarial value, meaning that generally it's going to have to return 60% of the premium to employees in the way of benefits. Okay, same thing with 70%, 80%, 90%. Remember the deductible limit that I talked about, the $2,000 limit and the $4,000 limit for family coverage. This is the area that those limits do not seem to work. For instance, to achieve a bronze level actuarial value, what the insurance companies are discovering is they cannot have just a $2,000 limit or a $4,000 limit. They have to have a higher deductible requirement in order to even reach these particular actuarial values. They can't provide the coverage other ways. So it's interesting to see how things like this are going to roll out. We don't know for sure what's going to happen. A plan's going to meet a particular level if it's within plus or minus 2%, 2 percentage points. Now, what does this all mean? Why do we even look at these things? In the exchange, there's going to be a variety of coverages offered. Some not so valuable, not so good, such as the bronze, some very good, such as the platinum. The employer is going to have the option to go into these exchanges and select coverages from various levels. For instance, if they elect a bronze plan and they elect a silver plan, they can require their employees to contribute a little bit more to get the more generous benefits under the more expensive silver plan than if they participate in the bronze plan. And that's the idea for offering these different levels or different actuarial values of coverage. Calculators have been provided. That's something that you're not going to have to really worry about to determine actuarial value. But that's something that Dina may have to worry about, I assume. So, right. Okay, benchmark plans. Each state must select or be assigned a benchmark plan, and I think I told you that has already been done in Oregon. And really, we'll probably just move on from this and talk about what we're going to be doing. The SHOP plans, I've already talked about how this is going to work. And the bottom comment there does not apply in Oregon. Okay, on April 1st, 2013, Health and Human Services delayed the federally operated SHOP exchanges in 33 states. They cannot get the SHOP plans up and running on a federal level for the these states that are not establishing their own exchanges. So they're delaying it. Okay, but in Oregon, we're ahead of the curve. Our exchange is going to be up and ready to go by 2014. Roles of agents and exchange navigators. This is where I talk about, do you make the decision, do you want to bypass Dina and her services, or go directly to the exchange, if you want to continue to work with Dina. The information that we're getting is this. The cost, number one, is going to be the same to you as an employer. Okay, if you go to the exchange, you're going to be working with what they call a navigator. A navigator is going to be probably somebody from the community, somebody who gets in and knows the plans, can give you some basic advice of the plans, but is not going to be experienced in actually providing good, sound benefits advice, is not going to take a look at your overall benefit program to see what works best within your benefit program. They will be able to provide you with cost information and coverage information. So you have to look at where you're going to want to go for your services. Navigators will provide objective information, while producers will be advising. Producers being somebody like Dina and her crew. They're going to be giving you advice as to what is going to be doing. The navigators are not going to give you advice. They're not going to make recommendations. They're not going to be trying to sell a particular product. Navigators will come from, like I said, community church groups and advocacy groups that have been serving the community. The concerns that I have regarding going to the navigators and bypassing somebody like Dina or whoever your agent or broker is number one, is accountability. There doesn't seem to be any accountability based upon the services provided by a navigator, meaning this. If the navigator gives you some wrong information or bad advice, who do you go to? How do you get it corrected? We don't see any accountability, and I guarantee you, if Dina were to do that, or any of her team were to do that, you would know directly who to go to. Okay? You don't want to hear that, do you, Dina? But that's true. That's
So
true.
they don't have errors and omission
Right,
coverage.
right. As Dina mentioned, they're not going to have their malpractice insurance, their errors and omissions insurance to cover any errors that they may make. And so, to me, that alone is probably enough reason to stick with your agent or broker. The other is the services that are provided by your agent or broker, such as your employee meetings, making sure that all of the deadlines are satisfied, your document work is all done, and everything else. So you're going to have the option of just going directly to the exchange, but think twice before you do that. Okay? And I'm not just saying this about Dina because I'm working with her. I'm saying this about any of the brokers or producers that are out there. Okay, Cover Oregon, that's the Oregon Exchange. And it's going to be operational beginning in October of this year for coverage beginning on January 1st of 2014. It's going to provide the services we've already been talking about. You're not required to participate in Cover Oregon. Miscellaneous Cover Oregon rules. Employers with fewer than 50 employees are not required to provide health coverage for employees. At least 51% of employees must be employed in Oregon. Participation requirements of this, 75% or more of a small employer's employees must be enrolled in the health plan, 50% for dental. Okay, there's always participation rates in any insurance policy that you're going to be enrolled in. Tiers of coverage, employee only or employee independent coverage. Domestic partners may be covered, or you're not required to cover them. Enrollment deadline, employees must be enrolled by the 22nd day of the month before coverage will become effective. And once you get a policy or premium rate, it's going to be locked in for 12 months. This is coverage through the exchange, Cover Oregon Exchange. The Small Business Health Options Program, that program that allows you to go in and purchase coverage through the exchange. Qualified health plans are made available to small employers. All full-time employees must be eligible for coverage. There are going to be new ways to offer employee health coverage, and there are going to be access to tax credits and easier administration. The SHOP program will be limited to business with 50 or fewer employees in 2014 and 2015, and to 100 or fewer employees beginning in 2016. Once again, if you have 101 or more employees, you may not purchase coverage through an exchange at least until 2017 at the earliest. Okay. Yes.
If you enroll in the shop, are you then required to do that? Like, say you enroll in the I'd rather go with my agent.
Just drop out of the shop coverage. I haven't even seen that mentioned anywhere in the rules, to be honest with you. It's a good question. You enroll and you don't like what you're getting through the plan. Keep this in mind that what you're going to be lacking by going through the SHOP program is the recommendation, the advice, the expertise of Dina and her team or whoever your broker is. But the coverage is going to be the same. It's going to be the same types of policies that Dina could place for you. So the coverage itself is probably not going to change. Once you select a policy, though, I believe you're locked into that policy for at least 12 months.
Right,
Yeah.
yeah.
Mhm.
It's not even compare between your agent and the shop if you've never experienced it. And then if you do and you don't like it,
Good question. I think you just have to do how do you compare? You got to do your homework ahead of time. You know, make the best choice you can, and hopefully it's not the wrong choice.
And you can have an agent through the shop experience.
okay.
Right.
So then,
So,
And the price is
and the price is.
The price is no different. Right.
There's really no
Right.
reason not to have an advice.
Right. Price is going to be the same. You're going to get way more services and more expertise.
The only benefit maybe to going to an exchange, a shop exchange or a small business, would be if you get that tax credit. If you meet that criteria, and if you like the idea of having a couple different options for your employees to choose from. Beyond that, there's really no difference in the private market and an exchange. If you get those tax credits, that to me is the biggest value. And we want to look at that.
Yeah, very good. So oh, yes. Mm-hmm. Okay.
Ask the same question. Going back to the last thing of
Right.
qualifying the large or small business, we're in a situation where, say, half of our employees are in the union and they have their own plan. They're not in a, pen to maybe the payment.
Right. You have some collectively bargained employees.
Right.
Mhm.
So when you say 50 employees, is that company?
I have not seen that particular issue addressed anywhere in the guidance or the regulations. Generally, under the Affordable Care Act, though, collectively bargained plans are carved out under many of the requirements, and it seems reasonable to assume that it's going to be based upon the number of your employees that are not collectively bargained, that are not union employees. So if you have 20 non-union employees, those would be the ones that would probably determine your size. But that'd be just a guess. I haven't seen that explained anywhere. It's one of the probably many issues that the government never anticipated. There's a lot of things they don't anticipate, primarily because they're not here in the field like you are every day, actively working in it. We can probably check on that for you if you'd like. Can you write the note down on that and make sure I have it, and I'll take a look into it. Okay.
Similar question on that
Yes.
is
Mhm.
if you have two different companies, but they're closely held corporations,
Yeah. Right.
right now we have a common paymaster,
Right.
but are we gonna have to break out payrolls and each one has 25 employees as opposed to?
You know what? Remember those awful regulations and requirements that I talked about we're going to get into?
Yeah.
That's where we're going to go. But you hit exactly on some of the problems that you're going to be looking at. Okay. And Dina knows because she sat through that before when I've gone through those explanations. It's terrible. But it'll give you some good answers on that. Okay. So any more questions right now? Okay. So do any of you like wine? You like fine wines? Yeah, head's shaking. My wife loves wine, and she just drink the Merlots. But you know what? She discovered the Oregon Pinot Noirs. She loves the Oregon Pinot Noirs, and she used to like wonder about our friends who like stick up their nose at some wines, and because she'd say, well, they're like wine snobs. But now she's become a wine snob. I've noticed that she'll have a glass of wine and say, "Oh, that's not very good wine." I've heard that Oregon produces some of the finest Pinot Noirs in the world. It's something to do with our climate and soil and all that, better than the French wines. We were at a really nice restaurant in Washington, D.C. and looked at the wine menu. The most expensive wine on the wine menu in this nice restaurant was an Oregon Pinot Noir. It ran more than $300 for a bottle. Kind of shows you, they're really treasured. Many of my friends love wine. I don't. I don't like wine. I don't like the taste of wine. I've tried going to wine tastings and I've eaten it with different cheeses and all that. I just don't like wine. In fact, I cannot stand the smell of wine. And I think it's something something chemical or something with my body. I just don't like it. So, you know, and I won't, this doesn't bother me because I just soon not go to a restaurant and pay $20 or $30 for a bottle of wine, or you know, or more than that, $50 for a bottle of wine. And you know, I'm happy with my Jack Daniels or a beer. And so, you know, I feel like I'm kind of, you know, getting through these hard economic times by not liking wine. And so, but I'm going to give you a warning, okay? The next time I have any of you over to dinner at my place, okay, and we'll serve you a nice prime rib or salmon or something like that. We'll give you a nice meal. We're not going to give you any wine because these are tough economic times. And